أهلا وسهلا بكم جميعا. معكم دكتور همام مندورة، استشاري جراحة المسالك البولية وأمراض الذكورة وضعف الانتصاب. في ظل الاهتمام الكبير اللي حظى فيه له مركز عناية الخبراء الطبي في الفترة الأخيرة، وهذا بفضل العدد المميز من حالات زراعة دعامات الانتصاب اللي تم إجراءها بنجاح، وهذا النجاح والتميز جعل المركز محط أنظار العديد من الخبراء في هذا المجال. اليوم نتشرف بزيارة ضيف استثنائي هنا في المركز بمدينة جدة، هو أحد الرواد العالميين في جراحة المسالك البولية التعويضية. معانا البروفيسور الدكتور ستيفن ويلسون، جراح المسالك البولية التعويضية ذو شهرة عالمية واسعة. يتمتع بخبرة تمتد أكثر من 46 سنة. خلال مسيرته المهنية أجرى أكثر من 11,000 عملية زراعة دعامات في أكثر من 53 دولة، وقام بمشاركة في تأليف أكثر من 200 منشور ومقالة افتتاحية، بالإضافة إلى كتابة 5 كتب دراسية حول جراحة مسالك البولية التعويضية. بيعرف دكتور ويلسون بابتكاراته في تقنيات زراعة الدعامات وتقليل مخاطر العدوى، مما جعل هذه الجراحات أكثر أمان وفاعلية للمرضى في جميع أنحاء العالم. وهذه الزيارة تجي في ظل النجاحات اللي حققه المركز، مركز عناية الخبراء، وإحنا سعيدين باستضافته اليوم في جدة والأول مرة في السعودية. نتشرف بوجوده معنا. دكتور ويلسون, welcome to Jeddah and to Expert Care Group.
Thank you very much.
Dr. Wilson, once again, welcome to Jeddah and welcome to Expert Care Group. How has your experience been so far here in Jeddah, and how do you like the atmosphere in the city?
I think this is a terrific facility here. I love the big wide open operating rooms. You seem to have the latest of equipment, so I think the patients in Jeddah are quite lucky to have this facility.
Yeah. Thank you so much. So we have taken a tour of our facility and we're excited to hear your thoughts and what is the impression of the setup and services provided here.
Well, I think the advantages of a system like this is that it's modern and it's clean, and so surgeries that are not particularly invasive can be done, and they can be done to the comfort of the patient, but also controlling the cost versus the big hospital. So if a patient comes here to have his eyes worked on, or his prostate, or his penis because he cannot get an erection, this is a terrific deal. It's less costly than going to the private hospital, and it's clean and beautiful and quick.
Dr. Wilson, as one of the leading experts in benign procedure surgery, what do you think define a center of excellence in the field? And what are the key factors that make the center a global reference for benign implant surgery?
Well, in the United States, only 25% of the American urologists do one implant. And I'm sure it's even worse in Saudi. Most urologists don't want to fool with it.
Yeah.
And we've learned that the guys that do 30 or 50 a year, they do it better and they have less complications. So a center of excellence for a very, very specialized little niche of surgery gets better outcomes, happier patients, and the physicians develop an expertise which is repetitive year after year.
Okay, interesting. So, number that makes the center attractive destination for the patient. Would you give a number or for?
Yeah, I think you really have to do one a week.
One a week.
Yeah, but otherwise you kind of, if you do one a month or one every 2 months, you kind of forget the tricks of exposure, and you're not as quick. And the biggest disaster we have with a penile implant is a device infection.
Yeah.
And that's almost directly proportional to how long it takes the surgeon to do it.
Okay.
So we're looking for quick surgeons who do it every week, and that's why they get better results and fewer complications.
Good.
While you're thinking of your next question, I think I'd like to tell the patients how lucky they are that you can have a penile implant in this country at such a reasonable price.
Yeah.
It's 3 times as expensive in my country.
Oh, really?
Yeah. And we do the same thing you guys
it's around
do.
30,000
US.
Oh.
And we do the same thing that you guys do, but we have to charge more because our hospitals charge us more. The prosthesis costs us 3 or 4 times what you pay. So the patients are very lucky, and you're doing a minimally invasive through a tiny little incision, so that there's very little discomfort. The patient can take a shower in the locker room in front of 10 men. Nobody would know he had it in him. If he doesn't tell his sex partner he's got one, she'd never know, because the erection is completely natural, and when it's not erect, we hit the little button, it goes down, and the appearance is perfectly normal. Sexual enjoyment is there, orgasm is there. So it's invisible, it's natural, and great deal. In this country, it's cheap.
That's good. So many patients consider penile prosthesis surgery but have concerns and questions. Based on your experience, what advice would you give the patients who's reluctant to do it?
I always tell the patient, forget that old penis. You're going to have a new penis. And this one's going to work. And it's going to look good. And so we all tend to remember the old penis that we had when we were in our 20s and had about 30 less pounds on us. You just got to forget the old penis.
What are the most important things they should know before making the decisions of going to operative room, inserting penile prosthesis?
Well, I think that all that's necessary is that they've tried the pills, and either the pills work or they don't work. And if they don't work, I think the next step, if you want to you and your spouse want to continue to have sexual relations, I think the next step is just to go ahead and have a penile implant. I tell patients, my patients back in the United States, you can play golf in 2 weeks. Most guys don't even take a pain shot. So it's pretty minimal surgery, because we've been doing it 52 years, and we've got it honed down so that it really affects the patient minimally.
But I mean, also you have the patient supposed to know the exact expectation post-operative and exact risk that they may occur during the post-operative period. This is also important to make the decision of the patients.
Well, I think the most important thing for the patient to remember is that the scrotum is like the eyelid. If I hit you with minimal force in the forehead, you're going to get a black eye. If I hit you with the same force on the arm, nothing happens. So the scrotum is just like the eyelid. It blows up and swells. So for 48 hours after the surgery, if the patient will just remain still with an ice bag on his scrotum, he's not going to have much more discomfort.
Dr. Wilson, when it comes to penile prosthesis surgery, patients often choose between inflatable penile prosthesis and malleable penile prosthesis. Based on your experience and exposure to patients worldwide, what percentage of patients typically opt for inflatable device versus malleable one?
Well, doctor, it's strictly cost. I mean, it's like driving a Honda or a Mercedes. And we all want to drive a Mercedes, but many of us can't afford it. So we have to drop back and get a malleable. But if you can afford the price, which is twice what a malleable costs, then you should have the inflatable, because
so mostly the cost will drive the decision.
I mean, it's a much nicer experience. You don't have to worry about concealing it. It's totally natural looking. It doesn't stick out. But if you can't afford the inflatable, then I say get the malleable, because you can still have a great sex life with a malleable. It's just a little more inconvenient.
Great. So have you noticed any trends in different regions, such as US, Europe, and Middle East, in terms of patient preference, surgeon recommendations regarding choosing malleable or inflatable?
Well, in my country, everybody gets the inflatable because it's reimbursed. Most of the guys that we do a penile implant on are 65, and they have government insurance, which covers it. So we tell them, do you want the malleable or do you want the inflatable? And 25 to 1, they pick the inflatable.
This is also one of the misconceptions here, that inflatable will break down easily. They need to reoperating again after a while. Not like malleable, it's more persistent. So this is one of the misconceptions you will always face.
It is a misconception, and as a matter of fact, the inflatable penile prosthesis is the most dependable device put in man. It's less likely to have a redo operation than hips, knees, heart valves, breasts. lenses for the ophthalmologist, you name it. The most dependable. And
That's really valuable information.
and it's even, the malleable is not better. The inflatable is better.
Exactly. So, the next question. Many patients are curious about the difference between having penile prosthesis surgery performed by an expert or subspecialized andrologist comparing with a general urologist or non-specialized doctor. How significant is the difference in terms of the outcome, complication, and patient satisfaction?
Well, we have scientific publications that show that a guy that does 1 or 2 a year doesn't really know how to do it very well, and he has a 25% revision rate. 25%, the guy has to be reoperated within a year. Whereas the guy that does 50 a year, he has a 5% revision rate in 5 years.
Okay.
So the more...
So in terms of the outcome, it's really matter choosing a good...
you don't want some guy that does it once a year to do it on you. You want to go to a guy that does it for a living.
Yeah. Now we will address some common beliefs held by patients and the community, and we need you to comment on and clarify on whether they are true or false. So only older men gets implants.
Oh, well, it is a disease of older people. Unless you're young and you have type 1 diabetic, there's no reason that you're going to get the impotence. So yes, the average guy who has it in my country is 65 or older, and he uses it once a week for 10 minutes. But he's very, very happy when he's using it.
Good. Okay. One patient is writing, it is a very complex and dangerous surgery. He is talking about the penile implants. Is that true or false?
That is false unless somebody who does 1 or 2 a year is doing it on you.
Exactly.
And then it is complex.
So overall, it's supposed to be a very safe surgery. Overall.
The guy that taught you to do penile implants, he does them in 20 minutes.
Yeah.
I do them in 20 minutes. How could it be complex if it takes us 20 minutes?
Interesting. Okay. The surgery will affect sexual sensation and ejaculation.
Nothing is changed.
Nothing has changed.
You can still have an erection, looks completely natural. You can have an ejaculation. You can have a climax.
Orgasmic pleasure, the same.
Yeah, everything.
The patient always imagine that the penis will look fake or feel fake after the penile implants.
No, the penis just looks like a penis.
Like a penis.
Yeah.
So, no difference between the
difference.
It's natural.
To be honest with you, some patients say, well, my penis is not as long as it was when I didn't have the surgery. And what the problem is, they remember their penis when they were 29 and 50 pounds lighter. And so they don't have as much penis outside their body. We didn't shorten it. We don't shorten it. We give you back the same amount of length that you had. But it's your fault if it's shorter, not ours.
The next, implants and especially inflatable penile implants break down quickly.
That's false. Like I told you before, it's the most dependable implant placed in man.
Yeah. Penile prosthesis surgery recovery is extremely painful and long.
That's wrong. That's false also.
That's false also.
If you just stay on the couch for 48 hours with an ice bag on your genitalia, most guys don't even take a pain shot.
So usually the pain after the surgery is supposed to be mild. And recovery within how many days?
Unless you get unlucky and your scrotum fills with fluid, you're going to sail right through this. Now, if you get unlucky, and it's really not a matter of unluck, it's the matter that they got up and went to the restaurant because they were feeling so good, and then their scrotum swelled. So it's their fault. But if you get some swelling of the scrotum, then you're going to have some discomfort. But if you'll just take it easy for 48 hours with an ice pack, you won't get that swelling and you'll sail right through it.
Great. So also another comment, the pump is very difficult to use.
Well, it depends on which model you're using, and it also depends on how much strength you have. Sometimes the patient, like for example, I have arthritis in my hand, and I don't have a lot of strength in my hand. Sometimes I can't even open a jar.
Okay.
And my wife takes it and she just opens it like that. So, but if you do have difficulty pumping the pump, we can teach your wife.
Okay. So for normal people, they don't have any problem with manual dexterities.
No.
It's easy.
Yeah.
Okay, sure. Malleable prostheses are better than inflatable.
That's completely false.
Penile prostheses surgery will affect my urination.
Oh, will it affect your urination?
Yeah.
No. There's 3 channels in the penis. If you look at a cross-section of the penis, 2 are erectile bodies where the blood goes to give you the erection, and the other one is the tube that you pee through.
Yeah.
We don't even go near the tube that you pee through, so it doesn't affect it one bit.
What your response to the patient who's telling you that after penile prosthesis surgery, I won't be able to father children?
Well, a type 1 diabetic, who cannot get an erection to penetrate his wife, he can't father a child. But if you give him a penile implant, he can father a child. And we all, I'm sure you do, I do, I've had scores of patients who are young diabetics and couldn't penetrate. And we give them an implant, they can penetrate their wife and they become a father.
Yeah, but I mean, it does not affect the ejaculation at all, so usually it will not affect.
No, it has nothing to do with it. All the penile implant gives you is the stiffness to penetrate. Everything else is on your own.
Okay, so the next one, it's most likely I will get an infection after insertion of the penile prosthesis.
Well, we're so lucky with penile implants because they're coated with coatings that retard infection. And none of the other implants placed in man have that. Hips, knees, heart valves, breasts, lenses, none of those have antibiotic coatings. We have coatings on ours, which in an experienced hand drops the infection rate to less than 1%. Now, 20 years ago, we didn't have the coatings. And I'm old enough to remember, I used to have a 4% infection rate. And I was doing 300 a year, which meant I got 1 infection every month.
Oh.
And that wasn't much fun.
And now the rate is much less now. It's less than 1%.
I haven't had an infection in a first-time implant that was not a diabetic in 20 years.
Interesting. Now we reached the end. It's been a pleasure having you here, and I hope you enjoy the rest of your time in Jeddah. Thank you again for being here and for sharing your expertise. Thank you so much.
It's a real pleasure to be here.
Thank you so much.